someone going to be sat in through my chair?
Over here? Yep.
Ready, steady, slide.
This is where we can connect something to strap
So
it
stretcher
down.
transverse.
I think I'd just go stretcher probably here.
That is internal fuel things to give us the extra range.
Probably here, unless you tell me that you want to go this way.
It's much more rugged inside. There's a huge amount of vibration. There's a massive amount of noise. The lighting is can be challenging, but they have the advantages of speed, of range.
We are going to have to go head first.
Germany's air ambulance service has never been busier. These helicopters are being used to move critically ill coronavirus patients from one hospital to another. The wards are beginning to fill. Europe's biggest nation took early action to try to stem the advance of the virus. It was well prepared, but not immune. Now the number of deaths is rising fast. But for the pilots and crew, this isn't just about Germany. The helicopters stationed here have flown into France and Switzerland to collect patients. Others have gone to Italy and beyond. But finding that precious space in the hospitals is getting harder.
It's a national problem for us here, as well as in France. But there are hotspots spread across the country. Some hospitals have beds available in ICU and others are already full.
Within these helicopters is this transparent pod, a Norwegian invention called an epi-shuttle. It isolates the patient while they're being transported. We saw it tested using a healthy volunteer. Air is pumped into the pod and then cleaned as it leaves.
We have a complete filter system here. So the air gets in from the upper side and gets through 2 filters. And we have the same filter types as well inside of the epi-shuttle. So we can be sure that no virus comes out to our ventilation.
All this means the crew don't need to wear cumbersome protective equipment, so they can react fast, and they do. Germany has a formidable medical infrastructure. Here's an example. It's got Europe's biggest fleet of 24/7 air ambulances, and the team here are going off to their first call out of the day, to Rottweil, about 50 miles from here. Germany has tested a lot of people, and it's testing more and more. It has a massive, well-equipped hospitals. It still has empty beds, a contrast to neighbouring countries, many of them struggling under the weight of patients needing intensive care. Across the border in France's eastern region, hospitals are at full capacity. We were taken inside one of France's most under-pressure wards in Colmar. This is the life support ward at the town's hospital, home to its most critically ill patients. The demand for beds here is enormous. Every time one becomes free, there are at least 10 requests to use it. 170 patients have already been transferred from here to other hospitals by road, rail, plane and helicopter.
We're constantly adapting how we work without really knowing if it's right or wrong, but we do our best. It's just not easy as a doctor flying blind in this situation. We are just not used to it.
This sort of cross-border cooperation doesn't normally happen, but now, under grim and intense pressure, it is working. Lives are being saved. Adam Parsons, Sky News, Rheinmünster, Germany.